Good afternoon, everybody. My name is Rob Curtis. I'm the Alumni Relations Coordinator with the Faculty of Rehabilitation Medicine here at the University of Alberta. Thanks for tuning in today. I'm streaming from Corbett Hall, the home of the only freestanding rehabilitation faculty in North America. Those of you who have watched our previous streams might be surprised to see me sitting here instead of in our large lecture hall, but today our presenter gets the big room and I'm physically distant. I'm back in my office elsewhere in the building for the first time in nearly 2 months. That was just for the live stream today. Like many of you, my work location isn't the only part of my life that's been thrown for a loop. Pretty much all of my usual activities are on pause right now. And so I'm really looking forward to hearing today's presentation about how we find meaning in our activities during pandemic life. One housekeeping item before we begin: the way that the Q&A will work in this live stream format is through the text chat. Everybody who's watching can type questions into the chat, and they'll be visible only to me. With so many people watching, we may have a lot of questions submitted, so I'll do some triage and I'll pass the questions on to Dr. Forhan verbally. I'll do my best to get to as many questions as possible, but please understand if we're not able to get to every question or if I have to group a few questions together sometimes. As well, we encourage you all to use the hashtag RehabMedLive if you are live tweeting during today's event. The Faculty of Rehabilitation Medicine is a world leader in rehabilitation science, physical therapy, occupational therapy, and speech-language pathology. Our researchers, faculty, students, and alumni are enhancing lives through rehabilitation around the world. We've created this new live stream series, Rehab Med Live, so that we can make their expertise available to you as a resource at a time when it's needed more than ever. As I mentioned in previous streams, the first president of our university famously said that knowledge must not be the concern of scholars alone. The uplifting of the whole people shall be our final goal. Our presenter, Dr. Mary Forhan's work centers around that same vision, working to ensure that all people have full and equitable access to the services and activities that they need and want in their lives. Dr. Forhan joined the University of Alberta in 2013 and was appointed chair of the Department of Occupational Therapy in 2019. She has practiced as an occupational therapist and educator in the areas of obesity, mental health, and chronic disease management for over 20 years, and has worked in hospital and private practice settings as well as educational and research institutions. We're very proud to have Dr. Forhan as part of our faculty, and we're very grateful to her for sharing her expertise with us this afternoon. Dr. Forhan, welcome, and I'll pass the floor to you.
Great. Thank you, Rob. We're just sharing the slides there. It's a little unusual for me to be standing here in an empty lecture hall, and my students and anyone who's been in this room with me before knows I like to chat. So I'm going to be spending about 25 minutes or so giving you a presentation that hopefully spurs some great questions and we can have a discussion. It's really exciting for me. So thank you so much for everybody for taking some time out in your day to join me for this next hour. It's such a wonderful opportunity for me to share with you my passion for the art and science of occupational therapy. Specifically, my goal today is to share with you the simple complexity of the role that arts and crafts have played in helping individuals and communities to cope with occupational disruptions for more than a century. And of course, we'll talk about occupational disruption in the context of living in a pandemic that for many of us is really the first time we've ever had to do that. So let's get going here. 59, that is not my age. It is the number of days, if I calculated correctly, of physical distancing and COVID-19 precautions that have been in place, at least in the province of Alberta. This is the number of days that many people have experienced occupational disruption. What is occupational disruption? Well, it's a temporary inability to participate or a disturbance in the usual patterns of occupations. What does this mean? What does this concept of disruption mean? There has been some review of the literature from some of my colleagues, Alexis Nazero, Paige Cote, and Heidi Cram, who looked at the literature and terminology of occupational disruption back in 2017. So what they found is that really over the past decade, this term has been used more and more in the literature, but there's not real consistency in how we define it. So for the purpose of today, this is the definition that I'm going to use. Really, other concepts that are included here is the inability to participate or fully participate in occupations that we choose or things that we have to do in our day-to-day activities. But it's a temporary disruption. And when we first heard about COVID and the physical distancing and precautions that were put into place, I don't know about many of you, but I thought, a couple of weeks and we'll be back to business as usual. Set up my home office for a couple of weeks and realized I was actually there. This is the first week I've actually physically been back in the building. So it's been much, much longer than what we all anticipated. What are some consequences of occupational disruption? So occupational disruption associated with COVID-19 precautions is not really that much unlike the way in which occupational disruptions have been experienced as a result of maybe some chronic health conditions that have flare-ups or relapses where unexpected timing of disruption in your ability to be able to perform daily activities comes up. It's also recognized in the times of natural disasters where there's temporary disruptions in our day-to-day activities or a traumatic event. So the consequences specifically is a change in identity. Our roles change. What we do and how we identify on a day-to-day basis with the occupations that we perform have really shifted. And if you think about some of the roles that suddenly were spurred onto people, such as, working from home full-time, homeschooling children, operating a daycare from your own home, trying to do multiple occupations simultaneously that maybe perhaps prior to this have been a little bit more compartmentalized. It's also changes in our roles that were taken away, that were removed. So people experience layoffs, people experiencing shifting into full-time caregiver roles for family members or friends who may not be well. The change in lifestyles and routines that happen. So the way we go about our day-to-day. I was actually in quarantine for the first 3 weeks due to some illness in my household, so I wasn't out during those first few weeks when precautions were in place. And I remember going to the grocery store the first time, it was probably in early April, and not used to the protocols that were in place and actually getting somewhat yelled at by somebody for going the wrong way in the grocery store. And that's spurred by fear and not knowing the routines. But just the way we go about doing things, we can't just grab our car keys and go out to the store or do things in the same order and with the same freedom that many of us were used to before. It's changes in the way that occupations are performed. So how, for example, today we're doing a lecture, we're doing it completely remotely, which me being a people person, I really miss that face-to-face interaction. So the way we go about our meetings, the way we manage a business, the way we run our households have all changed. The way retail, people who never shopped online before are probably shopping online a lot more than ever. Restricted participation in occupation, so not having the same breadth and depth and diversity of options that we used to have on a day-to-day basis, even though these are temporary. So identity and meaningful occupation appear to be mutually dependent. As a result of restrictions and closures associated with managing the spread of COVID-19, individuals have either lost or gained occupations. So we're changing these identities, as I said earlier, from perhaps being a paid employee to being laid off or unemployed. It could be to being a part-time caregiver to now being a full-time caregiver for a family member. For some individuals, home care services have had to be stopped or suspended or not as frequent, where family members or neighbors are taking on more of those caregiving roles. We've become teachers to our children, early childhood educators, and telecommuting full-time jobs. This all creates threats to our identity. The social and emotional impacts of occupational disruption is quite relevant as well. There's a variety of feelings that are included here. Excuse me, I have allergies and this is a very dusty lecture hall. I assure you I am well. So Rob has to come into this room afterwards. I promise you, Rob, we're good. So the social impacts of occupational disruption are reported as a result of the precautions that we have to implement to reduce the spread of COVID-19. And as I said, these have been very similar to those that people have experienced with chronic health conditions or a traumatic event. So they include a reduction in the social interaction, the feeling of being isolated and disconnected, The restrictions that have been placed on gathering in public places, places of worship, places of leisure, places of socializing. It's a major loss that has been reported by many, many people. Individuals who enjoyed that sense of belonging and connection associated with being a member of a group have either had to have those put on pause or develop new ways of connecting through virtual means or technology. But not everybody has access to that technology, and not everybody's comfortable with that technology. There's a loss of connection with friends and family. However, there are some individuals who are actually quite happy with the physical distancing and the social interaction restrictions, that it has caused them a break from some stressful situations where they felt forced to interact. So we're seeing some more positive reactions where people are saying, this is great, I'm getting a little bit of a break from things that make me uncomfortable. I suspect that once we do have more freedom to move about, there will be some anxiety associated with those interactions again with this new and unfamiliar situation that we're in. Although the days of physical distancing are growing, even individuals who are not comfortable with social interactions are starting to get a bit antsy, a bit wanting to get out there. There's this sense of frustration that we're starting to build, which I'm going to talk about in a minute. There's a loss of control when our occupations are disrupted and we don't know what the next step might be. We feel vulnerable. What next? What now? How do we do things? Things that used to be fairly routine, as I said, such as grocery shopping, now we have to do it in a different way and learn a really instinctive type of skill. Driving. I had not driven for almost a month because I was at home and I wasn't going anywhere. So just getting behind the wheel of a car and driving again was actually something I had to pay much more attention to because it wasn't as instinctive as it had been before. We're also seeing this really interesting shift or change in values and priorities. What maybe was a priority was filling your schedule full of activities and meetings and social engagements is now maybe giving people an experience with a less full calendar and maybe enjoying that and seeing the pleasure that might come from those breaks and maybe some more time for some self-care. So that's going to be interesting to see what happens. We're finding your way. I initially had finding our way. But everybody is experiencing this pandemic differently. So I heard a phrase, and I can't remember where it came from, so I apologize, I'm not citing it properly, but we're all in the same storm, but we're in different boats, or we're in a different place in the storm, or have different resources around us to help cope. So rather than us all saying we're in this together, I think the spirit of that intention is quite good, that we all want to look out for each other, but we are all experiencing this in our own way and finding your own way on what works for you. So in terms of the initial phase, we're labeling this occupationally thriving. So we're talking about occupations that are focused on protection from becoming infected and keeping safe. That was meaningful and purposeful. And we really started seeing this the first few weeks when the physical distancing and the realization that COVID was here, that it was real, and it was a serious threat to our health. There was a strong sense of community connections as individuals put the needs of others before their own. During these times, it was typical for us to see a higher level of occupational enjoyment and satisfaction, doing activities such as checking in on a neighbor, offering to deliver food or medicines to people who could not get out, to this strong sense of hope in getting things back to normal. So there was this energy and altruism that was really happening early in those 59 days. The next phase, which is where I would say we may be at right now, we're calling this occupational liminality. And liminality is a state of transition from one stage to the next. It comes from the anthropology sciences. Individuals here now no longer hold their pre-COVID-19 patterns of occupation, but there's little or no clarity on what patterns of occupation we're going to hold in the future. We don't know next week what the rules and regulations are going to be to protect us and to protect those around us. It's really hard for us to know what is going to be normal. Is it back to business as usual? When? How? Is there something called the new normal? We may even describe the stage where we are currently in as being suspended, where we're waiting for that next directive, that next realization, where we have to learn to pivot. We hear that phrase a lot right now, we're pivoting and adapting. So you're wondering, when is bread coming up in the conversation? We were talking about, why is everybody baking bread? So I'm sorry if you joined in that you thought I was going to teach you how to cook bread. Believe me, you don't want me to do that, because you don't cook bread, you bake it. So right there, I would have steered you down the wrong path. Why is everybody suddenly baking? So after the initial rush to secure the toilet paper, the hand sanitizer, the masks, the next wave of purchases were baking supplies and then arts and crafts supplies. Instagram and Twitter accounts were filled with images of freshly baked loaves of bread, trays of muffins, batches of waffles, or sheets of cookies. And it's not just baking. Next came homemade face masks, crocheted shopping bags, retro knitting patterns for socks, throws, instructions for building birdhouses, outdoor play areas in people's homes, homemade putting greens for those who were craving time out on the golf course, invitations for group sing-alongs online. I joined one of those. It was actually quite a lot of fun. But why is everybody finding these things? What's going on here? The knitting that's happening. The crocheting, I bet you a few people have these on their beds or their couches. I know I have a few. And building things, and even gardening. So why arts and crafts? So a professor of mine from the University of Toronto, when I was doing my occupational therapy training in the mid-'80s, Dr. Judith Friedland was the chair of the Occupational Therapy department back then. And she was always so passionate, and still remains very passionate, about the history of occupational therapy. And she was a speaker at a seminal Muriel Driver Memorial Lecture, which is the highest honor that can be bestowed to a Canadian occupational therapist, where they prepare a lecture and a publication on a topic of their choosing. And I was preparing for this session today, and I got to reread Dr. Friedland's Muriel Driver Memorial Lecture. And it really reminded me of the history of occupational therapy, and how now, during a pandemic, we're seeing a return to arts and crafts as a way to focus, as a way to create structure, as a way to seek meaning and purpose, and to clear one's mind. And the question that Dr. Friedland asked in her Muriel Driver lecture was, why crafts? So why? Why are people being compelled to baking, to crafting, to doing these activities that seem old-fashioned to some? Some are taking them on as hobbies that they've resurrected, that they used to do, and others are discovering them for the first time. There's a movie that is one of my favorite movies. It's not one of these Oscar-winning movies, but it just really, one of those movies I just never forgot, which was released in 1992, called Beautiful Dreamers. And in that movie, they really demonstrate the use of crafts as occupations was found to restore the soul. And I've worked for 20 years in the area of psychiatry, and we use arts and crafts many, many times with clients and with our patients to help with focusing, with help with distracting, to help with skill development, and also to maybe open up the lines of communication, to share emotions, to share feelings, to build trust, and to boost self-esteem. And that goes back more than a century in the field of occupational therapy. So another interesting thing, that North Battleford, Saskatchewan, there was a very successful occupational therapy department, I'm sure there still is, in the early 1900s that was known for bringing the arts and crafts movement into occupational therapy. And that resulted in improving the mental health and sense of well-being in patients who were isolated from society, who were in asylums at that time. So occupational therapy is based on the understanding and belief of the power of occupation, of the value of being engaged, and of the harnessing of creative energy. So engaging in a craft or an art or something like baking is an occupation, and it's therapeutic. It's a means to an end for some people. Crafts historically have been viewed as a means to maintain self-esteem, to develop skills, to distract from pathological thinking. And this holds true today, just as much as it did more than a century ago. So here's some quotes that I saw from people who were posting on Twitter or Pinterest or Instagram and Facebook about what doing crafts or baking has meant for them. So I have the opportunity with reduced work hours to spend time alone in the kitchen creating bread from scratch. I'm surprised at how therapeutic this activity has been. The creative process and the sense of accomplishment fills my cup, and the bonus is that I could share my baking with my neighbor. That's the beauty. The people are doing their own occupational therapy without even knowing it. Crafting online with my friends or at home with my kids helps me keep track of the days. Sometimes we don't even know what day it is, what time of day it is, and focused when my normal routine is not there to support me. So we're finding these hobbies and these crafts and these activities, these new or resurrected occupations, are really helping people develop a sense of normal routine and structure that in itself is good for mental health and well-being. The response of individuals to COVID-19 with arts and crafts, including baking, is a real-time example of how people are engaged in a form of occupational therapy. To me, it's a call to occupational therapists to reconsider our roots and how we look at how we explain the value of occupational therapy. I'm really pleased that we get a chance to showcase some of that today. And how we can help individuals and communities adapt occupations in the response to the occupational deprivation and disruption caused by COVID-19, and how occupational therapy is an important intervention to address the physical, the social, and the emotional recovery needed as we continue to live in the context of a pandemic. The roots of occupational therapy lie deep in the soil of political, social, and artistic ideals prominent at the turn of the 20th century. The initial treatment tool was occupation in the form of craft. Now, we do much more than that, but I wanted to focus in on that today for today's topic. And that came directly from Dr. Friedland's Muriel Driver lecture. Occupational therapy is a means by which occupational therapists help individuals and communities get back to the job of living, even in the context of a pandemic. So Rob, with that, I'm going to open it up if there's questions on the chat.
Well, thank you very much, Mary. If anybody who's watching has some questions, please feel free to type those into the text chat. Those will pop up over here, and then I'll pass those along. Mary, I've got one sort of general question here. The question is about change management, essentially, and wondering if you have any advice about managing the changes to our occupations that we can anticipate are going to happen with a possible reopening. How do we manage that change and navigate it in a healthy way?
Yeah, I think that's a great question, and it's hard to know when we don't necessarily know what's going to be expected or what we're going to be encountering. And I think the key is to be open-minded and to be flexible in being open to change, that we might have to do things in unfamiliar ways, but that doesn't mean we compromise our values and our safety and our own well-being. So be comfortable asking questions. Asking why a certain protocol may be in place, asking what your responsibility is if it's some situation where you may be going back to work or reintroducing your children to activities, whatever it may be. Don't be afraid to ask questions and understand the rationale behind, because sometimes, you know, just by means of putting on a face mask is such an unusual or uncomfortable behavior. It's not typical for us. I just finished moving yesterday from one house to another, and a moving company came and they used really great protocols. We kept our social distancing, but they all had dark face masks, face coverings on. There was no way I would have let 3 strangers into my home with their faces covered with a mask in any other circumstance, but it became so normal. I realized later it didn't even occur to me that there was an issue. It was part of our new day to day. So give yourself time, be patient with yourself, sit with the discomfort. Change can be unsettling sometimes. So, you know, be informed, be flexible, ask questions, and be okay to take your time with it.
And we have a question here from Jane as well, who notes that we often hear an emphasis on maintaining routine right now. And she's wondering if you have a comment on that as far as it connects to maintaining occupation.
Yeah, routines are important, but what is a healthy or positive routine for one person is not necessarily a healthy or a positive routine for someone else. So when people say keep a routine that's meaningful and valuable for you and those that you need to interact with. So if you know you need a certain amount of sleep to function, make sure you keep with that. But if you know that, I mean, for myself, maybe it's not the best thing, but I can function quite well on 6 hours of sleep a night. I'm not going to change my routine to have 10 hours because that might be a recommendation that is put out there. It might not fit for me. So, you know, find something that works for you. We talk about balance a lot, occupational balance. That doesn't mean that you're spending equal amounts of time, let's say in, you know, household tasks, paid employment, leisure. You want to find the balance that works for you. So if, you know, your balance is 70% work and 30% self-care and leisure, and that works for you and you feel good about it, then you keep that. So find, I guess my biggest point here, Rob, is really find a routine that works for you. Protect it, try to stick with it as best you can, but also don't get worried if you go off track. Just get back on track when you can, when it makes sense for you.
Thanks, Mary. There's a couple of questions here as well that look at this idea of the new normal and looking ahead down the road. You know, I think there's a lot of people that look ahead to that maybe with some anxiety. You know, it's almost like for some people now there are more options. How are we going to shape our life once we have the ability to go back to some of the old occupations? It's another sort of change management question, but I wonder, do you have any comment on that, sort of looking ahead to the new normal? What does that mean? What might that be like, and how do we manage it?
Yeah, it's interesting because the new and normal seem opposite to me because normal to me seems familiar, seems typical, seems predictable. And I'm not so sure that we really know. I think it's going to be new for all of us. I think a lot of us are going to be experiencing some of the barriers and restrictions that we haven't experienced before. And initially when you know, COVID hit, we thought it's just going to be a temporary blip. We'll get through it and we'll get back to normal. But given the time frame and given the length and given the breadth of how this impacts everybody, I think we have to be really approaching it as an opportunity. Maybe an opportunity to find better ways of doing things. As I said earlier, some people are realizing now that they've had a little bit of time to sit and reflect or experience a disruption, that can actually open the doors for some brand new opportunities that you otherwise would never have been open to consider it. So we might be forced into a little bit of change, but I would encourage people to embrace it as best as they can and be open to the possibility that you might find something that is better than it was before, but give yourself permission to have time to adjust and also be okay to talk about it. I think what concerns me a great deal is the mental health of our individuals in our communities. As we move through, you know, the new normal. And I'm really pleased to see that talking about mental health and talking about mental health disorders is more public. People are sharing more, and I don't want to see that lost. We have to keep that momentum going, look out for each other, reach out, listen, take time to pause and listen. I was talking with a reporter earlier today, and we were talking about, what do you think people will still remain kind? Because there seems to be a kinder, friendlier vibe, at least when I'm walking around Edmonton. Edmonton's always been a pretty friendly city, but I suspect this is going to continue, and I hope that that's going to help all of us adjust to what this new normal, whatever that may be, looks like.
And there's some great discussion happening in the text chat as well. So thank you for typing these comments. I'm just going to kind of throw some of them out there, Mary, in case you have some reaction to them. Talking about looking ahead, and you're talking about people remaining more kind. There's also some discussion about whether or not some other things might stay the same. For example, work-life balance might shift permanently, sort of society-wide. Or even if that's something, that we're discovering the benefits of it, if it's something that we should generally be promoting as a society. Any thoughts on that?
Yeah, I mean, as I said, I'm very much a people person, but I also do like my quiet time and that opportunity to just decompress. And I've actually been surprised at how easily a number of people have adopted technology and being able to use, remote services like Zoom or Life-Size that we use here at the university, or FaceTime, Google Hangouts. There are a multitude of options. That my month of May was supposed to be an absolutely ridiculous travel schedule from one city to another to a province. I was actually supposed to be in the UK today, which I'm missing. That was a vacation to meet my new grandson. But I think what we're finding is that we may have options that we didn't see as viable options before to do our jobs, that actually may reduce the stress of some of the travel that some of us have to do for our jobs. It may reduce the health of the climate, of the environment. It may give people, this has forced us to demonstrate maybe in some environments that working from home is still productivity, that employers and companies are still getting good value for their dollar for their employees who are still managing lives. And can you imagine what is possible if once daycares get up and running and schools get going again, if people are able to work at home without having to be 5 other positions at the same time? I think, we may see more flexibility, which I think is really great for all of us, to give us more choice on where we work, how we work, and maybe that'll give us more quality of time with those around us, more time with our children, more time with our partner. And I don't think it's about more amount of time. I think it's the quality of time. So what we do with that time, I think hopefully we'll see an improvement in that.
And here's a question on a different topic from Joanne. Going back to, in your presentation, you mentioned that some people may find some of these restrictions to be actually a relief from situations that cause them anxiety. Is there a danger there for people who are dealing with, for example, things like agoraphobia, to backslide a little bit during this? And how do you have any strategies to suggest for how they might cope with that?
Yeah, that's come up a few times actually, is getting really comfortable with being in your own space. And if people were more prone to being afraid to leave their home, feeling uncomfortable, highly anxious, to the point that it becomes disabling, where you're not able to do the things that you need to do outside of the home environment. What I'm really hoping that we're going to see is supports for more mental health supports. So having home care supports. When I was working in the area of mental health, one of my roles was actually doing home care and working with people who had, let's say, agoraphobia or fear of going outdoors, was to be able to do some desensitization and gradual exposure therapy to help people gradually feel more comfortable. And so those are the kinds of things we're going to need. People face-to-face to be able to help talk and support people through the stages of exposure and reducing that level of anxiety. I'm really hoping that people can have access to those emotional supports, but also to the medications and the treatments that they need. And some of those things, it didn't matter how good we might be at communicating remotely. That physical side-by-side coaching is going to be really important for some of these mental health disorders that are out there. One of the things that I've been thinking a lot about is I have a really strong fear of flying. And I have to fly a lot for my job. And I was just getting to the point where I was actually feeling quite comfortable flying because of the amount of exposure I'd had. And I feel like I personally am starting all over again because of the moratorium on flying right now, I've been thinking a lot about that. So I think it's about, making sure we have the supports available. It's going to mean that we open up our healthcare services and that we have access to healthcare professionals and supports that are going to help people through those changes, and that sort of gradual reintroduction and exposure to whatever that new normal is. And, there's lots of professionals out there that can help. It's a real interprofessional approach, and occupational therapy is part of that. I think too, just as I'm talking, school anxiety is another one of children and people who are anxious in the school environment. That's something the teachers, when they get back to the classroom, are really going to be needing support and helping support those students who are had anxiety around school, but now with that lack of exposure, it may be very, very difficult.
And that's something that has actually come up at all of our streams, is how this relates to children. And many parents are finding that their kids are having a lot of trouble adapting to changes in their routine and in their activities and that sort of thing. Is that anything are there any particular strategies that help when helping your kids, or any comment on that side of things?
Yeah, I think sometimes we don't, as adults, we think that maybe the kids can easily ride through things or aren't as aware of what's going on around them, but they really pick up on our anxieties too. So I think it's about, being able to manage our anxieties as well as we can, but also being open about our emotions, in an age appropriate level, depending on how old the children are in your household, giving them the space to verbalize and to talk about how they're feeling. And they may not be able to verbalize that, but pay attention to the behaviors. So if there's some behaviors that are showing maybe some regression, going sort of backwards to a more earlier years types of behaviors, pay attention. Those are usually big signs that the child is trying to say something, is trying to express some discomfort, and find ways of, going for a walk if you have that option to do that. Just sitting and, when we talked about arts and crafts, sometimes just having kids engage in, making something with Play-Doh or with coloring or drawing you a picture about how they're feeling can really open the doors of communication and really give us some insight into what they're thinking, what they're hearing. Something I would really encourage people who are around children is to be careful what you have running in the background with the news, with the television reports. That can be, when you don't have the full understanding and can filter out the drama from the reality, it can be quite disturbing and quite upsetting for children. So I've really minimized their access to social media and news of things that may be out of context or concerning for kids. And so maybe monitor those kinds of things as well.
In the chat, Jane makes the great point that for children, their primary occupation as students has been closed off, or at least has been changed radically if they're learning at home now. And that's a very interesting lens to be looking at in trying to help them through this, is looking at how their other occupations may need to expand in order to fill that void, I guess. Is that a fair thing to say?
Yeah. Absolutely. Yeah. When you think about it, one of the primary occupations is as a student, and maybe finding ways within the home to have roles expanded. So maybe helping with some chores around the house that can be made into games or made fun, shifting responsibility. Also, setting up some structure as well. So trying to keep the schoolwork going as feasible as possible. I know it's not always easy or doable, but try to have maybe some set time where, okay, from 9 to 9:45 is going to be quiet reading time. Maybe we'll have outdoor play if you have outdoor space that you can access, or maybe create a little play space in the apartment or the condominium or wherever you may be, so that you're providing some school-like structure within the home environment. But you can be a little bit more flexible with that in terms of when you want to do things. Maybe you have a child that really enjoys sleeping in. I know people are going, but what's going to happen when they go back to school? I'm saying, you know what? Go with what's working right now. These are unusual times. And maybe that's when you can get more work done in the morning. Your child sleeps in a little bit more longer, and then you do afternoon school or afternoon activities. So I think it's about finding meaning throughout the day, finding things that your children can engage in around the home, and trying to keep up with some of the schoolwork as much as possible. But do it on your own terms, what works for your family, and have the conversations that this is something we're going to do for now, and we may have to shift when the schools reopen and when we have to get back to that, and we're going to prepare for that. I'm hoping that the parents have enough notice that they can sort of gradually reintroduce, almost like what we do at the end of summer vacation. I know it's not the same as summer vacation right now, but getting back into sleep routines, getting back into routines that are more structured. So trying to do that as best as you can.
I have to say, I wish I had a kid who liked to sleep in. I've got a little morning person sleeping on the hall for me, so I don't need an alarm clock.
Maybe mine are all grown, and now they're at the stage where, a good sleep in is they're going to bed as I'm getting up in the morning, kind of thing. So.
Well, thank you very, very much. This is a topic that is just so relevant to all of us right now, and we really appreciate you sharing your expertise with us this afternoon. And I want to thank everybody as well who watched today's live stream. This new Rehab Med live series is all about our faculty and alumni coming together to uplift the whole people. So if you have any expertise that you'd like to contribute, or any ideas for future topics you'd like us to cover, please reach out to me by email. Just reply to the message you received with the live stream link. Our next stream is on May 27th. That's 2 weeks from today. It'll feature a panel from our Department of Communication Sciences and Disorders, sharing some ideas on how we can make new communication tools like video chats, like webinars and live streams, accessible to people who may experience barriers from hearing impairments to aphasia. So please check out our website for more information. That's rehabilitation.ualberta.ca. Thanks again for tuning in. Thank you very much, Mary, and I hope to see you all at the next one.